Today we're going to go over the flossing techniques and some of the important points when we come to flossing. First, when we take out a piece of floss, get a piece of floss at least 12 inches, maybe 18 inches long, okay? And when we put the floss, we wrap it around our index finger. And then we start wrapping on another index finger. Now, it's very important to follow the sequence. At nighttime, first we floss, and then we follow up with the brushing, and then the last thing to do is to use the Periomat fluoride mouth rinse. So first, I'm going to demonstrate on flossing on a regular mouth without any braces or bridges. So first, when you put it in, a lot of people, the mistake they make when they floss, they just go down, up, down, up. And I can demonstrate to you on another tooth, see what happened if you just use down, up motion. Imagine this is a piece of floss. If I just go down, up, down, up, you can see there's only a limited surface area which the floss can clean. However, if you wrap around the floss as much as possible around the tooth, and then you drag the floss back and forth like this, do you see how much more area you can be able to clean? So this is very crucial. The second very important thing about flossing is we have to understand the anatomy of the tooth and the gum. Over here, the gum comes down and forms an area what we call the pocket. So it is very important when we floss, we push the floss as deep down into the pocket as possible. So two things, wrap around the tooth as much as you can and push the floss into the gum pocket as deep as you can. So let's actually demonstrate on the model. Also, another important thing is a lot of people, they will floss all other teeth. First, you go down there, and they forgot to floss the very back of the last tooth. However, don't forget to floss this part because plaque will collect 360 degrees around each tooth rather than just in between teeth. Another important thing is when you go push the floss down, don't just snap it down. If you do, sometimes the floss might damage the gum. So what you do is you put it up against the contact and slowly drag it back and forth, slowly drag it back and forth like this until the floss gently pass the contact. Once you pass the contact, you want to wrap it around the tooth as much as you can, push it down into the gum as much as you can, and then slowly bring it up. After you've done this part, then you go back to the same contact, go down and do the other side, or do the other teeth, and slowly bring it up. Now, a lot of people, after you use this part of floss, you will roll it up here and let it go on the other hand. A lot of people have one common complaint. They said, oh, I don't have any problem flossing my front teeth, but I cannot get all the way back to the molar area. The reason is the person must have one finger inside the mouth, the other finger outside the lip, okay, or outside the mouth. So be sure you make the distance between the two floss short. The shorter the better, compared to you make it long. All right. You want to make it short so you have better control. And second is you want to put both hands, thumb and index finger inside the mouth, inside the lip. That way you can go as far back as possible. All right. Now, I have just finished demonstrating how to floss on a normal mouth. demonstrate on what happens if people have braces. As you can see, when people have braces, they have a wire coming across. The question is, how do I get past the contact with the wire in place? So it's very easy. I'm going to show you. What you need to do is to get some floss thread. It comes in a package like this, and it's basically a little plastic needle. So what you do is you tie a little knot onto the plastic needle and form the rest of the floss. When you floss, what you do is you will put the plastic needle underneath the wire. Okay? Once you pull it through, it's very much like sewing. You pull the floss underneath the wire. Now, you can go down and floss the two teeth just like regular teeth. After you finish flossing, you just slowly, gently pull the floss out. After you've done it, then you have to repeat the same process and go back to another tooth and put it underneath and drag the drag the floss underneath the wire, and then again you will floss one tooth and then you floss the other side. Now, besides braces, some people also might have bridges. A bridge is a false tooth that replaces missing teeth. If a person have regular teeth, and all you do is, again, go through the contact, and you can floss before the tooth in front and after. However, if there is a bridge, the floss cannot go down because they are all connected together. So once again, you have to use the plastic needle. You will put the needle underneath the bridge and stick it through. Do you see how it gets underneath the bridge? And as I pull, the floss will just go underneath the bridge, and you grab the floss, and then you can easily floss this tooth in the front. After you're done, don't pull it out, and just pull it underneath the bridge and get onto the other side, and now you can floss another abutment on the other side. After you're done, just gently pull out the floss. So isn't that simple? So since it's a very easy task, maybe at the beginning it will take a little more effort. So my suggestion is, for those who does not floss, currently flossing now, what you should do is just concentrate doing the front teeth first. Okay? You should do it right. After you've done it correctly, and then you can slowly move back towards the back of the mouth. And also another important thing to remember, at the beginning, you might have a lot of gum bleeding when you floss your teeth. Do not stop flossing just because you realize there's some gum bleeding. The more you floss, the less gum bleeding you will experience. If you have any questions regarding the flossing technique, and you're welcome to ask any one of our office staff, and we'll be very happy to help you. Thank you very much.